Hi guys, my name is Dr. Rubben, and I've been working with stem cells for the past 4 years, and I'm here today to explain to you all about what can be done by using stem cells and how much of benefit it can bring for our health, for our wellness, and to what extent we can actually achieve recovery or repair for the problems and the illnesses that we may be having. So let's talk about the types of stem cells that are available. So at this point, technology has improved tremendously in the healthcare sector. Stem cells, starting off from blood to fat, now we have come to Wharton's jelly, dental pulp. So there are a variety of stem cells available in the market, each with its own specificity and its own possible benefits. So if we are talking about blood stem cells, then there are certain illnesses which can be treated using blood stem cells. For instance, you're talking about things like leukemia, and these are proven certified therapies which are available for people out there. If we are talking about other kinds of stem cells like mesenchymal stem cells, which can be divided into fat, for instance, fat stem cells have been widely used in many countries for aesthetic purposes, for joint repair. It is being used for even chronic illnesses. However, there is a catch when it comes to fat stem cells, where we will need to acquire these stem cells from the host or from the individual themselves. And the procedure is quite invasive, where we will have to put in a tube to harvest the fat from your body. It can be a little bit painful. It can be quite scary to look at. Fortunately, with advancement in the medical sector, we have been able to retrieve stem cells using Wharton's jelly. Wharton's jelly is basically a component of the umbilical cord. And as we all know, most people would probably discard the umbilical cords after the baby is born. But that piece of umbilical cord contains so many millions of mesenchymal stem cells that can be used for many forms of therapy in the medical sector. Now, when we are talking about Wharton's jelly, we are able to acquire mesenchymal stem cells which are immunoprivileged, meaning they do not have the markers that will identify the differences between the host as well as the recipient. That means the cells can come from anybody, but it will not trigger an allergic or an immune response in the recipient. This is very good because this means that we do not have to put the patients through any invasive procedures like what we need to do when we are acquiring fat cells. But instead, we just have to get the cells from the Wharton's jelly, and then the administration can be done. Now, when we are talking about immunoprivileged, that means these cells can also be used in a few types of situations. For instance, host versus graft reactions, like for instance after we undergo a transplant procedure, for instance, these cells can actually be used to prevent the rejection from the host, which is amazing, and this is currently being used in many advanced countries as well. Stem cells in general have the tendency or the capability to do two things. One, stem cells can make our bodies, or stem cells can signal our bodies to produce new stem cells. Now, before we move on further, let me explain to you about stem cells in our bodies. Now, everybody has stem cells in the body. It starts off at a very good amount when we are younger. Of course, when we are born, the stem cells are at a higher amount in the body, and therefore our body's ability to repair damages or to overcome illnesses is much higher compared to once we are aged. And as we grow up, these stem cells in the body tend to the amount drops, and they drop pretty significantly once we hit 20 or 30 years of age. Now, when we are about 50 years of age, the stem cells in your body may be less than half of what it used to be when we were younger. And this means that the body's capability to defend itself or to repair or regenerate will be much less. Therefore, when we have an injury at the age of 50, the capability of our body to overcome that injury, for instance, to repair the damage or to repair the skin, will be much reduced compared to a child. And we may have things like scarring, we may have things like improper healing, whereas a child who has an injury would probably see that injury disappearing within a couple of months with no scar whatsoever. So this is what stem cells does. This is what stem cells can actually do to our bodies, and what we are doing now is basically taking those cells from the Watten's jelly and putting it back into our bodies so that our body will be able to function like how it would at a younger age. So this is the theory behind stem cell therapy. And we know that if our body can actually do what it was doing when we were younger, that means chronic illnesses such as diabetes, such as high blood pressure, has a higher tendency to be overcome compared to not doing anything at all. So this is what stem cells therapy is about. Let's talk a little bit about mesenchymal stem cells. Now, mesenchymal stem cells, like I've mentioned earlier, they have two properties. One, they enhance your body to produce more stem cells, meaning that your body will have a better chance at fending off against diseases, you will have a better immune system. And at the same time, the second function of stem cells would be to repair and regenerate damages that have already occurred in your body. For instance, if you're a diabetic and if you have diabetic retinopathy or diabetic neuropathy, that means you have damage which has been caused by diabetes. For our bodies to overcome or repair that damages, it may take too long or it may never happen at all because it is a progressive problem. But with stem cells, we have a high possibility to overcome these problems and therefore bringing our bodies back to a point where it was not damaged or it was at a healthier position. So this is what stem cells can do.